I appreciate Councilmember Ward for his leadership and his commitment on this issue. It's always important when we talk about the challenge of those who are unsheltered and the challenge of those who are homeless, is to keep in mind that this could be any one of us. These are citizens of our city. You know, I fought in 2 wars, and by the grace of God, I came back and adjusted back in, but there are those I served with who went through the same experiences, who came back and because of a minor difference in the chemistry of the brain, struggled with mental health injury. Often leads itself to substance abuse and addiction. And so when we look and we see those who are on the street, we have to remember that those are our friends. It's who we grew up with. It could be our cousins or our brothers. It could be our own children. It could be those we served with in the military. And we have a sense of moral obligation as a city to not allow our loved ones to exist and live in these types of situations. And it demands action. The situation in San Diego is bad. It is much worse than it should be, and we need action. We see the city leading. We see nonprofits leading. We see private philanthropists leading. We see the business community stepping up, and we need the County of San Diego to step up. We're standing in front of a facility. I was just told by a resident that they have security guards in front of this county vacant facility, and the security guards stop homeless people from coming out of the canyons and breaking into the facility. We'll open the facility and let the homeless folks in. Provide the care and treatment and assistance that they need. The need is clear when you look at our healthcare system. Overcrowded emergency rooms, not enough beds. The need to make sure the safety of our neighborhoods is clear. The need to alleviate law enforcement, to not spend so much of their time on a preventable problem that we should be addressing is clear, but the solutions are clear as well. They're not easy, but they're clear. We know what we should be doing. Let's take evidence and data that shows things work. Let's move swiftly to put those programs into place. Let's measure the impact, and let's show the progress. Recuperative care facilities are a key part of evidence-based measurable things that we know work. A few weeks ago, we led an effort calling on the county to increase the need for more inpatient psychiatric care, inpatient beds. And that is important as well, but it's just one piece. Today we are proposing another piece, to open this county facility behind us as a recuperative care facility. These facilities provide unique services. They provide treatment, recovery, and assistance for homeless individuals whose injury is too severe to be accommodated by a traditional shelter, but is not so severe as to need inpatient psychiatric care. These facilities allow homeless individuals the opportunity to begin the recovery process in a safe environment while accessing medical care, mental health care, substance abuse services, and most importantly, putting them on a pathway for housing, a pathway for a sustainable life, a pathway for a safe life. A report earlier this year by the United States Interagency Council on Homelessness specifically cited recuperative care programs as a vital link, a piece of a strategy for preventing and ending homelessness. Hospitals are struggling and they need assistance so people aren't going to the emergency rooms that ought to be going to a facility like this. We also need help, and folks who do need to go to an inpatient facility have a place as they get stabilized to step down to. We have seen with interfaith community services that this model is successful, that it works, but there are not enough of these. The crisis facing our region demands action. Currently in the entirety of San Diego County, there are only 73 recuperative care beds. There are only 41 in the city of San Diego. The county government of San Diego has the capacity to open this facility and more than double our capacity to address this problem, but they're failing to address the gaps in the system. They need to lead. They need to fund these vital services. They need to step up to partner with the city, with our successful nonprofits, with our business community, to make vacant but appropriate facilities like this one into centers of impact, transforming lives, making a real difference, shouldering their share of the load as we all come together collectively to try and solve this problem. Thank you.